What's up, neuro nerds? It's been a little bit since I made a video about a neurologic diagnosis, and so today I'm going to talk about myasthenia gravis. So myasthenia gravis is a chronic autoimmune disorder that is characterized by the production of antibodies blocking the acetylcholine receptors at the neuromuscular junction. So that is where the nerves and the muscles meet. That is where the impulse from a nerve actually activates a muscle to produce either contraction or inhibit a contraction. But in this case, it's blocking acetylcholine, which is necessary for muscular contraction, and this leads to weakness. And if you didn't go to PT school or weren't a kinese or exercise science major, let's briefly go over acetylcholine's role in muscle contraction. So like I said, the neuromuscular junction is where the nerves and the muscle cells meet, and acetylcholine is released from the motor neuron at the neuromuscular junction, binds to the muscle cell membrane, the receptors on the muscle cell membrane, which is a gated ion channel. So as soon as acetylcholine binds to those receptors, the channels open and sodium ions rush through those channels to depolarize the muscle cell. This depolarization leads to an action potential, which then activates the release of calcium from the sarcoplasmic reticulum, and then this calcium binds to muscle fibers called myosin and actin filaments, and those slide across each other, leading to muscle contraction. There are genetic factors to myasthenia gravis, so certain HLAs can increase susceptibility. I won't go into specifics unless you guys really want to know, and then you can comment and ask me about it. There's also the potential that the thymus gland, because it's a part of the immune response, that tumors of the thymus can be associated with myasthenia gravis. The role of the thymus is the maturation of T lymphocyte cells, which are imperative in our immune response. And also infections or medications can trigger the onset of myasthenia gravis. Signs and symptoms of myasthenia gravis are drooping eyelids, which we refer to as ptosis, double vision, which we refer to as diplopia. The reason double vision happens is because your eyes do not converge and focus on one object, and so basically your brain is getting two separate pictures of what's going on in the environment, which leads to double vision. Facial weakness, including difficulty smiling, chewing, and swallowing. It can also lead to weakness of your arms, legs, and trunk, and then in severe cases, difficulty breathing. Now, this gentleman has myasthenia gravis, but just note, facial weakness, especially facial drooping, is also an acute sign of a stroke. So if this happens to you out of nowhere, go to the ER. But it's also notable that warmer weather, infections, and stress can impact your symptoms, usually in making them more pronounced. Prognosis of myasthenia gravis. These people typically have a normal life expectancy unless they have a myasthenic crisis that leads to inability to breathe on your own, and then you have to go on a ventilator. In extreme cases, that can lead to death, but in most cases, most of these individuals are going to live a normal life expectancy. If they're seeking medical treatment to control their symptoms, then this can allow patients to have a good quality of life. So one of the main focuses of medical treatment is going to be cholinesterase inhibitors, so that acetylcholine is not broken down by the enzymes, and there's more abundance of acetylcholine, which means there's going to be more available to attach themselves to any available receptors. In some cases, myasthenia gravis does go in remission. Of note, thymectomies, when there are tumors of the thymus, can produce remission in up to 50% of patients that have a thymectomy. In terms of PT, this one is kind of simple in theory. You just treat the deficits, right? Are they having endurance issues? Are they having strength issues where they can't do things like carry their groceries, stand long enough to wash their dishes? Just work on what is difficult for them. But of note, you do not want to over fatigue them, so that way you prevent overwork weakness. Because if they already have that weakness and then you're working them out hard leads to further muscle breakdown, they'll probably be off of their feet and less active for a few days after, which means we're going to get even more atrophy of the muscle. So don't overwork these guys. Pay good attention to their physical signs and symptoms, and just make sure you're doing a good job with caring for your patients.